we had stark racial disparities in Louisiana early on in the vaccine campaign, in part with the same access to care issues that we deal with every day, but also in part to a lot of myths. And particularly the myth about fertility was very prevalent in a number of underserved communities across Louisiana. We identified that through the partnerships that we have, through the work of Ali Neal, our comms director, through the Bring Back Louisiana campaign, through media partners. We were able to really target that myth and empower local stakeholders and debunk it and pre-bunk it when we knew we were going into a setting, and all the things that we know are effective. And we were able to make progress. And now Louisiana is one of the small handful of states where the rate of vaccination amongst African Americans exceeds that of whites in Louisiana. Point being, for misinformation that gets spread unintentionally, I think once we're able to identify it, we can work towards combating it and show results. I've been less bullish on our ability to combat the more deliberate sources of disinformation. And this, I think, has caught the public health community off guard. The anti-vax, anti-science movement is stronger than it was 5 or 10 years ago. It's better funded, it's better organized. And I don't think we have found a great way to combat it. There are groups that have an agenda, that are deliberately exploiting people's fears and uncertainties about this pandemic, and there are many. And are doing that at great harm to families and communities who get caught up in that. That's what I think we need to be focusing on, is how do we combat that in this new sphere? And journalists and people that write about this and communicate this have a very, very large role to play. It's not easy. It's really not easy. Do you cover both sides? How do you cover both sides? Do you ignore the deliberate disinformation? Do you call it out for what it is at the risk of giving it more prominence than it deserves? All of these are tough questions. There's no one right answer. I do want to recognize Blake. I think Blake does a tremendous job at The Advocate of doing that, and it's really, really hard to do. But those are the type of questions we really have to be getting into. This disinformation campaign, number one, has cost lives. Absolutely no doubt about that. Hard to quantify how many, but I can tell you specifically from working in the ER clinically that I have treated families, patients who have fallen victim to these disinformation campaigns and suffered harm because of it.